Welcome to Medicine ND Point. Today we are continuing on urine test interpretation. This is part 5 of the video series in which we are interpreting urine RE. Now, today we will discuss proteinuria in urine RE. Urine dipstick usually detect albumin and Benz-Jones protein only. Other protein are not detected by the urine RE dipstick method. So if the urine RE shows proteinuria, means the transient proteinuria which was not present before. It could be a congestive cardiac failure, dehydration, exercise, fuel. Orthostatic proteinuria means the patient is standing for a long time like a school teacher or security guard. Seizure can also cause transient, means temporary proteinuria. In case if the patient has persistent proteinuria present from a long time, then usually glomerular diseases like GN, nephrotic syndromes, and multiple myeloma, these causes persistent proteinuria. Now, in case if there is false positive proteinuria, means it is actually not present but is detected in urine microscopy, then in that case alkaline urine usually causes the protein to clump together and present as proteinuria. Concentrated urine also causes protein to clump together and present as a false positive proteinuria. And a drug called phenazopyridine, it is a genital tract analgesic. It also causes false positive proteinuria. False negative proteinuria occur in acidic urine because the protein are not clumped together. Diluted urine, and when albumin is not the primary protein, in that case false negative proteinuria occur. When albumin is not the primary protein, it would not be detected by dipstick method in the urine RE, and so it will not be detected. I hope you like the video and thank you for watching. Please subscribe to the channel.